I'm going to be talking about neuroscience and its role in Scottish Government policy making. I am a social researcher by training, and I work in the Department for Children and Families. And so this presentation is really, I'm a spokesperson for that, for Scottish Government. I'm not suggesting that I have the expertise across all of these areas. I've collated this from a number of different parts of government to give an overview of the range of ways in which neuroscience feeds into policy. So I think the first thing to say is that the policy-making landscape is very complex, and there are lots of things that shape policy. So we're really shining a light on neuroscience today and almost holding a magnifying glass to it. But actually there are lots of things that go into how policy is designed and how it works in practice, from informal discussions, social media, the media, MSP surgeries, parliamentary debates, committee hearings, lobbying groups, advice from civil servants, including evidence from analysts like myself. So we're social researchers, economists, statisticians. There's no neuroscientists within government. So neuroscience is very much part of this very complex landscape influencing policy. Okay, and there are different ways in which neuroscience has influenced policy, right from the contribution of the field to our ambitions for Scotland, neuroscience being a core component of policy, neuroscience informing a policy focus and particularly practice, a rationale for investment. It's helped us to develop a narrative and capture the public imagination. It's helped to support what we already believed, but has now given us that rationale. And it's helped to inform our understanding of complex issues. So I'm going to talk through examples from each of these areas, and as it happens, it's actually a track through the life course of children. So, first of all, I think just generally, the Scottish Government has provided financial support to neuroscience through the Chief Scientist's Office. The Chief Scientist's Office provides funding research. So there are two funding committees that cover experimental medicine and health services, and then there's a small grant scheme as well. And these are really designed to give support to scientists, particularly the small grant scheme. It's allowing researchers to gather evidence on projects before they go to put in full bids to funding bodies. So I think this is just some recognition that the government does recognise that neuroscience has a role to play in helping us to understand what's going on in Scottish society, and will help us ideally to make Scotland a better place to grow up, but a better place for our people here. And the CSO has funded work such as in areas such as stroke, neurodegenerative disease, and cognitive aspects of ageing. So if there are any neuroscientists here or any scientists, do watch out for those sources of funding. So the first area then that I want to talk about is neuroscience being a core component of policy. And this is, I'm going to give the example here of fetal alcohol spectrum disorder. And so knowing then what's happening with the brain's development in utero has helped us to recognise the impact in particular of alcohol on the child's development. And so the fact that brain development is affected by alcohol at all stages of pregnancy, as you can see here in this slide, we know that this results in later difficulties with learning and behaviour, compromising the long-term educational and life outcomes. So we have Dr. Cross-Steer is heavily involved in this, so this is where we do have some expertise from neuroscience coming in to help us shape the policy, and actually is quite a core component of this team. And there's a recognition, though, that it's not just alcohol that is affecting the brain development of the fetus, but the other adverse factors can have an impact upon the development of the brain in utero, including poor maternal nutrition, increase in age, stress factors, cigarettes, drug habits, and obviously the efficiency the mother has at metabolizing alcohol. But this understanding of the brain and its development has helped to do three things, really. It's helped us to better understand fetal alcohol spectrum disorder, but it's also helped us to consider when to target interventions. For example, as a result of this, the advice on drinking during pregnancy is, the Scottish Government's advice is that there is no safe time within pregnancy to drink alcohol. Even at preconception, because alcohol can have an impact on the development of the child, the advice is that even at preconception, it's best not to drink. Okay. It's also been used to help train practitioners, and there are a number of ways I will go on to explain how neuroscience has been used to work with practitioners to help them understand and to be able to explain to their clients as well what they're seeing. In particular, to recognise the symptoms in infants, but also to work with mothers or women prior to conception, to help the practitioners understand why and how this is important, and thereby explain to women and mothers in particular. Okay, so that's preconception and during pregnancy. There's also a programme called the Family Nurse Partnership in Scotland, which helps to provide support to young mothers, typically mothers under the age of 20, but it's now expanding to mothers beyond that, just in their early 20s as well. And an understanding of neuroscience has helped to inform this policy, and particularly the practice. So in the first instance, it's working, the family nurses go and work and have a very close relationship with the mothers, right from early stages of pregnancy and all the way through up to the child is age 2. So the first place in which this neuroscience is used in family nurse partnership is helping the teenage mother understand the brain of the developing fetus, and to help, in particular, to discuss issues such as stress with the mothers. And this is explained in a way of trying to ensure healthy brain development of the developing fetus. The second way, which has been touched upon a little bit already, is working with parents to increase their understanding of attachment theory and how important this is in terms of the hardwiring of the brain, to help parents understand the positive parent techniques and to develop a secure attachment to support the learning and development and forming of positive relationships all the way through pregnancy and in the early years as well. Okay. So they also talk about human ecology theories, how the culture and the environment of the mother and of the child influences their development. So it's not just the brain, but the brain development, but the whole development of the child, and the brain development being part of that. So to encourage that stimulation, playing with the child, this kind of thing. Okay. Family nurses also have a good understanding of the teenage brain, because this is about working with the young mother as well, and helping them to understand the decisions that they've taken, that they're in a period of transition from into adulthood, and what that means for them. And that in particular, that the brain can be positively influenced by good relationships and role modelling. And so the family nurse takes on that modelling role with the young mother in developing, trying to demonstrate positive behaviours, and in a way trying to encourage the young mother to model those positive behaviours in the way that the baby will as well. Okay. And then finally, the FNP clients, the FNP nurses also use a strength-based approach to promote behaviour change. So again, this understanding of the teenagers, the stage at which they're at in their development, it's about trying to provide the tools and resources for the young mother to help her to move on with the child in a positive way. So thinking about the strengths that they have, the assets that they have, and how they can rely upon those to help develop positive outcomes for the mother as well. Okay. So the next example I'm going to provide is early learning in childcare, and there are a number of ways in which neuroscience has come into discussions around this policy area. Firstly, it does provide part of the rationale for why early learning in childcare is so important, and there's a quote here about the cognitive stimulation a child gets, particularly around the age of 4. The more developed the parts of their brains dedicated to language and cognition will be in the decades ahead. So this has helped us to provide a rationale for why that stage of development is so important, and why early learning in childcare might be helpful, particularly for some groups of children. Again, neuroscience has helped us to understand child development and attachment, so about giving a powerful experience in stimulating brain development. And this has been used in particular to work with practitioners about their role. So there was a publication this year called Building the Ambition, which is practitioner guidance for early years practitioners. This quote in particular specifies that what's not the early years practitioner's role as well. So in other words, it's not their job to diagnose insecure attachment. It's their job to try to promote secure attachment as caregivers who will be spending a lot of time with the children, helping to inform, helping to demonstrate to them the importance of the role that they have in helping to develop those secure attachments with the child and what they can do about it. And equally in Building the Ambition, then using that understanding to think about how then you create a positive environment, a learning environment for young people. So the settings that they create within the early learning childcare context, in terms of recognising patterns, repetition, stimulation, and so on. So again, this is in Building the Ambition. Equally, there's a part to play for helping parents to understand the importance of their roles. This is not just about early learning and childcare, but parents having a part in that development as well. The Play, Talk, Read is a programme that focuses on the home learning environment. So I've talked about early learning and childcare as a setting, but equally this plays through in terms of the parental role in terms of Play, Talk, Read. And finally, I think what's really interesting of late, and you may have seen this in the press, it's been used in marketing to attract new recruits. We've got a huge expansion to early learning and childcare. We'll be offering double the provision of early learning and childcare by 2020. And of course, that requires a lot more people to be working in the sector. Marketing campaign was really interesting because 3 different campaigns were designed. And then as part of the market research with young people, they looked at the different campaigns, and the feedback we had from that was that 2 of them they didn't particularly like, but the one that they did like and what they sought from a campaign was the recognition that childcare is not child's play, that actually it's a profession that's worthwhile, that has a positive impact upon children's learning, and they wanted more of that information going into the campaign. So this is the campaign poster. So this says, you won't just be making dens, you'll be helping their brains make millions of connections. And there's a website that I've provided on the first slide that takes you through. It's the campaign, it is the recruitment campaign for young people, and this appears in lots of different social media sites as well, some of which I'm not young enough to be hooked into, but our young people are, so that's where it's appearing. But certainly on the website, which I can access, these are the kind of things that you can see on there. So a real direct reference to how early learning and childcare, the profession of early learning and childcare, is really helping the development of the child, and particularly that brain development. Okay. You can have a look at this later on. Okay. So Neuroscience has also helped to develop the narrative and capture the public imagination. I think moving back to what Martin said at the introduction, people are genuinely interested in brain science. It seems to be one of these areas that people have a fascination with, perhaps because it is in its infancy, perhaps because there is still a lot to learn about the brain, and we don't know a great deal about it still. But where it's been used in the ACEs work, ACEs are the Adverse Childhood Experiences. If you've not come across this term before, ACEs are really coming into policy discourse now, particularly over the past year. But it's something it's research that's been around for quite some time, coming out of America in the 90s. But neuroscience is really helping us to explain toxic stress in particular, and in particular the aspect that children are highly neuroplastic, and that if their environment is unstable, and if they are in high-stress environments, their brain architecture adapts to this, which can cause maladaptive behaviour in wider social contexts. Okay. What this is teaching us, sorry, there's a little bit there about the different stresses, and it's leading us then to think about, well, what interventions are possibly needed. And this is a slide that was put up recently at an event in Glasgow from Professor Bruce McEwen, who talked about that really finding opportunities that find interventions that open windows of plasticity and change brain structure and function. So it's trying to, identify interventions at different stages that might be more effective for changing that neuronal architecture once children have experienced that high stress environment, that toxic stress. But also, what I'm particularly interested in, and particularly from social sciences as well, is how we use this then to think about the coping or the social mechanisms to mitigate the impact of this toxic stress at different life stages. So, for example, one of the areas that I'm interested in at the moment is about this, having this one stable relationship, similar to the poster on your seats today about aging. Similarly for young people as well, that can have a really play a helpful role in mitigating the risks of some ACEs. So I'm starting to explore some of that now, and in the very, very early stages. Okay. So I just wanted to say a little bit about the work that I've been doing on adolescents as well, and I think I think this has really underlined a belief that we had in government that working with young people had a really positive impact. But you're right. The earlier presentation did say that because of what was conventional wisdom at the time about the developing brain, particularly at 0 to 3, 0 to 5, and how critical that was, there was this belief that once the child reached 5, then that was it in terms of brain development, so we had to really invest all of our resource in that. But government has always held a belief that actually you can work with people beyond that age group and still have a really positive impact, and we've always done that. And it was great that we could then start to see in the late 2000s and early teens, so in the last 10 years or so, some of the work coming through on the adolescent brain, and particularly about the plasticity of the brain and how this is a real opportunity for us to work concertedly with young people. So one of the things I've been doing over the last couple of years is trying to share this work more widely, to underline the importance of the work that does go on in government and has long gone on with this age group. And I think, TED Talks, podcasts and so on, that are just accessible ways for people to start to understand some of the brain science around teenagers. And in particular, I think what it has done is just, as I say, just underlined the belief that people had, that the work was valuable. So it's helped to, I guess, improve that morale or motivation. It's just added another layer of understanding to why that work is effective and to keep going. Finally, neuroscience helps to inform our understanding of complex issues, particularly around young offenders. There's been quite a bit of work done in the young offenders institutions, particularly around Pullmont. And this is really about understanding why young offenders are in the system, helping us to understand or to respond better to their needs. And just what's happened in Pullmont, for example, and in young offenders institutions is that the brain science, the maturation of young people, the brain development and the potential effects of brain injury in particular on behaviour has been really part of the context for the work the Youth Justice Improvement Board has been doing and for the Scottish Prison Service of work with young people in custody. And so, for example, at Pullmont, there has been some training on the adolescent brain led by Professor Amanda Kirby at the University of South Wales. And so that's one example where practitioners are receiving some training and better understanding of what's happening with the brain so that they can help those working with young people to provide a more informed response. So just to conclude then, there are many ways in which neuroscience does feature, and these are just some examples I've been able to collate from the area of children and families. It's fair to say it is never a dominant or an isolated discourse, and I think that's really critical. But it is nonetheless a persistent discourse. It's bubbling along there. There are a number of areas, particularly in the area of children and young people, where it does emerge. And so the question that I would ask is, what is its future potential? What scope do we have? And I think one of the areas that I can see that we really know very little about is understanding, for example, the impact of social media and what can neuroscience teach us about this, and how can we better understand that. And obviously around older people's policy, I think that's an area that we'll need to understand better. Okay, thank you.